Hello, everyone, and good afternoon to you all. Good evening. Dr. J here at Ask the Gynecologist. Tonight, I'll be talking from my bedroom. And so, hello, everyone, and good evening here to you all. This is Dr. J here at Ask the Gynecologist. Tonight, I'm talking from the bedroom. I'm just exhausted from work, and I know that I have to be on live with you all. So I'll be talking from bedroom today. So apologies for that, but it's going to be a wonderful time. And I want to say happy new week to you all. And most especially, I'm grateful to God for having this opportunity to be here today. And I'm sure as well, you too, you're very grateful to be alive at this point in time. It's always a wonderful time whenever someone is alive, because it just shows us the measure of God's grace. For those that were able to attend the seminar we did over the weekend for the IVF seminar, thank you all. And for those that were not able to attend, don't worry. I'm still working on packaging the video, making them very, very clear and edited. And I'll get them published soon to you all so that you can have opportunity to watch the seminar videos, just in case you were not able to attend the seminar. So first of all, I want to say thank you all and God bless you. We are just at the verge, at the very, very edge of entering a new month, the month of May. And I'm making it clear to everybody that attended the seminar that you have the opportunity to get a discount at the IVF center, which is going to open June, July. And you can start making your deposits. Obviously, if you get pregnant before then and you haven't commenced treatment, you can collect your money back. But definitely, once the center opens, you'll be the first people to be attended to, and you're going to get that discount. And by the grace of God, it shall be so, and God shall do wonders in your life, even through ATG, by the grace of God. So good evening to you all. I can see people coming in on Instagram and also on Facebook here. I have Onuche Vivian, Chizoba, Chigoze, Bamiduo Buki, Lydia Ogochi, Okoro Favor, Sekinat Oluwatobi Alade, Hoya Glory, Omo Jane, Adefalake Kayode, Onikuyide, Blessing Prospect Dab, and Opara Oluchi. Thank you so much. So anyway, we are here, and if I've not mentioned your name, apologies for that. I can say Oluwafowokon Lotsi Fumi, Inchekube, Emily Cheesy, Agogo, Eragbere, Jesus, Vivian, Olu, Dave. And on Instagram here, I can see you all, but I might not be able to pronounce your name properly on Instagram because the names on Instagram, they always sound like nicknames and they are in kind of an acronym. So thank you, everyone. So tonight, there's this topic and I want to talk about is about coils, missing coils. I got a question recently. A lady had a coil fitted in, and the coil was a copper coil fitted into their womb cavity for contraception. And she went to, and she talked to me that obviously she had a coil fitted in for contraception then. It's about 10 years now, and she wants to get it out, but it's stuck, and she doesn't know what to do. First of all, I'm going to explain to you what a coil means. I wish I had that sample of coil with me. It's my library in the office, but I just had the time. I just had to sit down in the bedroom today. So, coils, they come in different forms, okay? We have the copper coil, we have the marina coil. And coils are designed as for contraception, okay? They stay in the womb cavity. They come in different forms and different shapes. But the most commonest coil we have today are the marina and the copper. The copper coil, as its name is copper. It's just copper. And the marina, as its name is a plastic coil that contains hormone that has been impregnated on that plastic coil. The marina coil is like a T-shaped coil. And in fact, some copper coils too, they look like T-shaped. Some look like horseshoe, like a curved U, like an inverted U. Some copper coil are like a U, like a horse shaped, and some are like a T. But most marina is in a T-shaped form, but marina is a plastic one. It contains coil. Both of them functions different ways, okay? Marina coil contains a progesterone type of contraception, and it stays in the womb cavity. We put the Mirena coil in your womb cavity. It helps to control your bleeding, control pain from bleeding, control endometriosis, and also act as a contraception. And Mirena coil contains only one hormone called levonorgestrel. It's a type of progesterone hormone. So it makes your period lesser in quantity. It makes your period less painful. If you have a painful period, it gives you contraceptive effect, okay? But it lasts for only 5 years. At the end of the fifth year, or towards the end of the fifth year, the Mirena coil's efficacy starts to drop significantly. But the copper coil is just copper. It's copper as its name is, and it stays in the womb cavity, and it can be there for up to 5 to 10 years. Okay, and the copper coil makes the environment in the womb hostile to sperm, so that even the fertilized egg or the sperm will not love it there, and they'll wither away. So that is the way the coil works. They prevent implantation, they prevent fertilization. Okay, and they are very effective. Only one of they work almost 99%. Only one time do they fail out of every 100. So a copper coil, Mirena coil, are very effective. But for some people, they'll have a coil inserted into them, and the coil may have gone, it's not well inserted. It will have gone into the wall of the womb and is embedded in the wall of the womb, and to take it out becomes difficult. That's why whenever we are inserting a coil, we must always document in the patient's note that the coil insertion was difficult or easy, so that whoever comes back to remove the coil will know whether there was any difficulty to insert the coil at the point of insertion at that time. Because if you find it difficult to put a coil inside, there's a high chance that that doctor or the nurse might have created a false passage and put the coil within the wall or muscle of the womb. And if that happens, the coil could become stuck there, and it becomes difficult to remove. Some people, yes, they put in the coil in the correct womb cavity, but sometimes during every periods, the womb is contracting. You know, the womb is like a muscle. It's a smooth muscle. It contracts. It might have moved the coil inside, and sometimes some coil, for some reason we don't understand, they'll find their way into the tube, and they'll find, you can see the coil on the intestine. I've seen it before. There was a time I was working in Kent in a place called Pembury, and we were looking for this coil in this woman. You couldn't find the coil in the womb. The woman went for x-ray. We saw that there was a coil, but the coil was in the bowel. So we went through keyhole surgery. We searched and searched and searched and searched. We couldn't see the coil. So then after a while, we started to look at the omentum. The omentum in the tummy is like a fat layer in the tummy. The omentum covers the tummy. So we started checking the omentum layer one by one. We now saw the coil embedded in the fat layer of the omentum. Inside though, not outside, inside, not on the skin, inside the tummy. So we saw the coil embedded there and tightened there, and when we resetted the coil, in fact, we almost gave up. So that person, while she was having the coil inserted, it could have been a difficult one. Maybe there was a false passage created, or sometimes too, the coil will just perforate the womb wall and it will find its way into the tummy, and it will go and be there, and the perforation in the wall of the womb will close, and the person's okay. I've seen a person about 4 years ago here in this part of the UK. She had a coil inserted 2 weeks before she came to see us, and I think the doctor, whoever did it then, created a false passage, and that thing led to her for having a PID. We had to remove the coil, take her to theater to wash her tummy to treat the infection in her tummy. But these are very, very rare, exceptional circumstances. Very, very rare. As far as the coil is inserted with somebody that knows what they are doing, that is appropriately trained and skilled in insertion of the coil, whether it's coil or whether you're putting implant in, the person must be skilled and trained to know how to put a coil or implant in. It is safe and is an effective form of contraception. But in cases where we cannot find the coil in your womb, okay, we have to look for it. That is why whenever we put in a coil into a woman or anybody, we always leave a tiny thread left over in the vagina, so that whenever we want to pull the coil out, we can pull it out. Whenever you want to start trying for baby again, we can easily grasp the thread in the vagina and pull the coil out. Easy. Very easy. And in fact, most people that have the coil fitted into them, their period is very, very stable, very light and very, very controlled. In very few cases, about 1/3 or less than that, their period could be irregular with the Mirena coil, but they are very few. That is Mirena. For the copper coil is only for contraception. It doesn't work for your period. It's only for contraception. And in most people, the copper coil is the best contraception. In fact, from my studies, I've realized that copper coil is the most reliable contraception. We use it for contraception, we use it for emergency contraception, and in most people that have medical problems that they cannot use other form of contraception, we always revert and default back to the copper coil, which is the oldest form of contraception, I think, in those days in China. Copper coil is the oldest form of contraception, is the most reliable, used for long-term contraception, used for also for emergency contraception, and is so good that if somebody has other medical problems like diabetes, arthritis, and they can't use contraception, we usually go back to use copper coil, and it works for people, very good for people. In exceptional situations, we use Mirena too. Mirena coil is a form of copper. It's a form of coil, not copper. It's a form of coil. That's Mirena, plastic coil with hormone on it. Hormone called levonorgestrel, or a type of progesterone, and it helps to reduce pain from your period. Helps to reduce bleeding. You're bleeding your period. It also helps to reduce pain from endometriosis, and it serves as a contraception, and it's very, very good, and it works for up to 5 years. However, if you want to get pregnant before the end of the 5th year of that contraception, Mirena, you can take it out. Your doctor will just grasp the thread and pull it out. Very easy. It's not painful at all. I've seen people, for some reason, they have the coil in and they forget Mirena, they forget it in there. It's now there for 6-7 years. It's now so comfortable, it's stuck into the wall of the womb. To take it out becomes difficult. For such people, don't panic. What we do is that we use a coil retriever to hold the thread like a fish and pull it out. Very easy. I've done it a couple of times before. Very easy. But it can be a bit uncomfortable for women too. So we give them some painkillers before we start that technique. For some people that we can't put it out despite all the effort, we go in with a camera, hysteroscopy camera, to look for the coil and then to retrieve them. These are very rare cases, very, very rare, exceptional cases. People that have coil inside them is not missing, easy to find. Like I said again, in very, very few cases, when the coil is being fitted in, sometimes the doctor that is, or nurse that is not well skilled, could push it in too far and damage the wall of the womb, and the coil will go into the tummy. And it does nothing, but it's not going to be useful for anything anyway. In such cases, we can leave it there, or we can go and grasp it and take it out. I've seen people, they fell pregnant while the Mirena coil or copper coil was inside. I said again that this copper and Mirena, they are 99% effective. For some people, it will fail. I've seen one lady before like that when I was working in York. This lady got pregnant while there was a coil in, and when the baby was being born, okay, as the baby was being born, the coil was embedded in the wall of the placenta. So when the placenta came out, we searched it, took it out, and that was it. So coil can fail, but it's very, very rare. Coil also has a slight increased risk of infection. If you are in a relationship that is not stable, okay, and you have a coil in, and you're always doing things up and down, you're always going out, doing orishi. By having unprotected intercourse, you're going to put yourself at increased risk of further infection if you have a coil in that has a thread, because that thread will act as a guide, communication pathway to get the infection to work out inside straight into the womb. That is why if you are not in a stable relationship, the best thing is to abstain from sex. But if you can't abstain from sex, the best will be to use condom regularly, unfailingly. By using condom unfailingly, no baby, no pregnancy, and also reduce the risk of infection. Okay, but if you are in a relationship that is not stable, I would suggest don't use copper coil or Mirena coil. You're going to increase the risk of infection. Okay, now before I continue, I'll take some questions and I'll continue again. I know people are listening to me; they have questions on their heart, in their mind right now, and they want to ask questions now. So please bring your questions on board. Let us trash them before we continue. Thank you, Miriam Oloyede, Linda Okoye. Chichi Amaka Ibe on Facebook, she's asking, Doctor, I did family planning implant on my shoulder. I have removed it since last year. Due to my hobby, he said he needs more baby, but I have not been able to conceive. Help me. So you remove this coil in an implant, okay? We put them there, and they can stay there for up to 3 years for effective contraception. And we remove them and we change them regularly. This lady has had her implant removed. In most cases, once the implant is removed, your period will start back again to normal after 3 months regularly. If your period has not been back to regular as it is, as so it's supposed to be at this stage, you removed it last year. It's almost the fourth or fifth month now. See what happens in May. If you're still not seeing your regular period by May, it will be an ideal time for you to start doing workup investigations to check for infertility why you're not ovulating. Okay, so by May you should see your period. If you haven't seen your period by the third week of May, then I'll suggest certainly consider doing your hormonal profile to know why you're not having your period. Somebody's asking a question: water is coming out from my vagina. What causes water coming out of vagina? Someone with endometriosis. Can the person stop? Okay, somebody has water coming from their vagina. If there's water from your vagina, it's two things. It's either your urine. Okay, that means that person has a fistula, a bad connection from the bladder to the vagina. Or number two, that person has a discharge that appears watery. The best thing is for you to get examined. Okay, let somebody that is competent, that is familiar with the terrain of vagina, examine you and see if this water you're talking about is coming from your bladder as a fistula, okay, or it's coming from a normal discharge or a bad discharge from vagina. Then we're able to treat it. Okay, your endometriosis has nothing to do with that. Okay, if you have endometriosis, it's a different thing to deal with, but endometriosis is not the cause of the water they are talking about. Okay, thank you. Doctor, can coil cause infertility? No. Coil is for contraception. Whenever you want to take it out, you take it out, your periods are back to normal, usually within 3 months. In very, very exceptional situation, a kind of contraception called Dopemu injection, we give that injection every 12 weeks, Dopemu injection. Because Dopemu injection has the capacity to linger on in the body. That's why it's called Dopemu. It deposits, it stays in the body, and it can linger on. After your last injection, the Dopemu medication for contraception can live on in your body for up to 12 months and you have no period. But it's very, very rare as well. But Dopemu injection has that behavior. Doctor, my implant will be 9 years in August. Why now? You don't put such things for your body for 9 years. Implant in your body for 9 years. If you have birth control implant for a few weeks after giving birth, and that month it was put on your arm, your period came like spotting and went on till, I don't understand. So your implant is for 9 years in August. You want to get it out and fix another one. When is the best time to do this? Yesterday. Your implant was there 9 years ago. The best time to remove it was yesterday. So tomorrow morning, go to the hospital and get that implant out first of all. And I'll suggest you don't put a new one in first of all. Wait for a month or two for your period to start back. Then now consider putting another one if you want at that stage. But if you're always forgetting something for 9 years, I suggest you consider some other form of contraception that you don't forget. Agege. What do you do if you have birth control implant few weeks after giving birth, and that month it was put on, your period came like spotting and went on for the next 7 days? Yes, implants can cause irregular bleeding for the first 1 to 2 weeks. So don't panic at all. In fact, some implants can cause irregular bleeding for up to 2 to 3 months. Okay, and afterwards they start to work fine. So give your body time 2 to 3 months for your implant to settle in before you get worried. Banji Jim Shimfish is asking, are coils hormonal? Not all coils are hormonal. A copper coil is not hormonal. Marina coil is hormonal. Jade's coil is hormonal. Okay, Marina is hormonal. It's a plastic coil containing progesterone. Jade's contains a progesterone too, but a very low dose. Okay, if I'm correct, I think so. And we have another one called copper coil. Copper coil is not hormonal. Okay, so not all coils are hormonal. Oluwaseun Teju Opayinka, doctor, my copper coil causes very heavy, not irregular bleeding. What can I do? Maybe copper coil is not for you. If it's still causing heavy bleeding after 3 months of usage, I'll suggest you consider taking and trying something else. See, the fact that we have contraception, we have a host of them. If one does not work for you, another might work for you, another might be ideal for you. So if one is not working for you, there's nothing stopping you from trying something else that might work. Because if one thing works for everybody, we won't have other options. That's why we have many types of contraception, different ones for different people, even for different one for these different people and for same people at different points in their life. For example, a woman is okay with a particular contraception, but as she gets older, her preference for contraception will change and she wants something else. It doesn't mean that the one she was using before it was not working. It just means that she's moved on and her lifestyle is different. So we choose contraception for you based on your personal preference and your lifestyle and your medical conditions as well. Okay, so we give you the best contraception that will suit your lifestyle, your medical condition, or previous medical or current medical condition, and your preference as well. So you see, so one thing might work for you today, and after some few years, as you're getting older, another thing might work for you, and something might work for another person entirely. Okay. What causes water from the breast? It could be hyprolactin. And if I do know if you have hyprolactin, don't guess. Go to laboratory. Call ATG lab tomorrow morning and go to a laboratory and check your prolactin, and we know that it's high or not. What of tablet form of contraception? You can use it. You can use contraception. We have pills. We call them pills. There are different types. We have the combined pill, which contain estrogen and progesterone in different quantity. We also have the progesterone only pill, which contains only progesterone. You can choose any one you want depending on your medical circumstances. Okay, so and depending on your skin condition, depending on your preference. Okay, so they are also safe, but definitely, like any contraception, some have their own side effects. Some contraception, they have very high level of progesterone, like the Yasmin. The Yasmin contain high level of hormones that can make your blood too thick. Some don't make your blood too thick. But if you have a family history of blood clots in your body, of blood clots in your system, if you have a family history of blood clot or embolism, you might be considering choosing a progesterone only pill. They have less and low, very, very low chance of making your blood thick to form blood clots, which can be dangerous. But the combined pill have the ability to make your blood too thick. That is why once you pass 835, if you're on combined pill, we switch you to low to progesterone only. Once you get to 835 or you're smoking, once you get to 835, we switch your contraception if you're on combined pill to progesterone only pill to reduce the risk of blood clots in your system. It's an IUCD. Sorry, I said implant. Okay. Ibi Fajolu. Yes, IUCD. That's good. Thank you. Odunjo, thank you so much, my sister, for being here. God bless you. And if you need any test to be done on you, infertility tests, hormonal profile, to check your LH hormone, FSH hormone, prolactin, AMA, testosterone, to check your kidney function, your liver function, your heart trace, ECG, to check your husband semen test, to check your ultrasound scan, to check your ovaries, to check your kidneys, to check your liver, to check your gallbladder, to check your spleen, to check your kidneys. If you need all these scans done, you can always go to ATG Laboratories. There's a question here on Instagram. Good evening, doctor. You've been taking clemastone for 2 years. Now you're having pain in your upper tummy, and you decide to stop taking it for 4 months, and ever since then, your period has not come. Please help out. Very easy, my sister. What you need to do, you stop this medication for 4 months, no period. That's okay. First of all, let's just check your hormonal profile. Let us check your FSH and see whether you're still ovulating. If you're still ovulating, in most cases, you'll probably get your period and they'll come back regular. Somebody asked me a question here on Facebook. What does coil make a woman fat after the implant? Is your Clara Dona, your question is wrong. Oh. What coil makes a woman fat after implant? Doesn't make sense. What coil makes a woman fat after implant? Coil is different from implant. A coil stays in vagina. Implant stays under your skin. They are two different things. Coil stays in the womb cavity. It goes through your vagina and stays in your womb cavity. Implant stays under your skin. Doctor, what coil makes a woman fat after the implant? Clara Donald Chukwebuka. Your question is totally wrong. It's not making sense, my sister. Coil is different from implant. What coil makes a woman fat after the implant? It doesn't make sense. Coil does not make you fat. Implant does not make you fat. And if you think your coil is making you fat or implant is making you fat, then take it out and use something else that will not make you fat. Because everybody reacts to things differently. Am I making sense? Doctor, I stopped the Dopemu injection in October last year. My menses started normal, but now no pregnancy. You've gone for hormonal profile test. You've been placed on Palodel. Is it a way forward? What is the way forward? So you've done hormonal profile test. For them to put you on Palodel, that means that your prolactin was high. If they've given you Parallel because of high prolactin, they should at least check your prolactin level again 3 to 4 weeks after commencing your Parallel. Sometimes 4 weeks after commencing your Parallel. And if your Parallel is not bringing down the prolactin, we might need to increase your Parallel. So first of all, most people will start taking Parallel on their own without even getting prescription. That will make you waste your time. First of all, if you're given Parallel, we should know your baseline function of your prolactin. And while you're on this Parallel, okay, after 4 weeks of taking Parallel, we should check your prolactin again to see if your body is responding to the Parallel. If not, we might need to increase the dose so that we can keep your prolactin level normal. If your prolactin level is high, you're not going to ovulate. Can coil fall out without knowing? Yes. Some people have heavy bleeding every period, and while they are passing clot because of the heavy bleeding, some people, their coil will fall out. There's a question here on Instagram. You had your baby through CS March last year. You missed your period this month. Is it safe to be pregnant now? Because you're really worried. You should do your pregnancy test. First of all, do your pregnancy test, okay? Do your test of pregnancy. Thank you everyone for listening to me tonight. I really appreciate you. I hope to see you tomorrow as well, so we can have more fun together. God bless you all. And once again, this is Dr. J here at Ask the Gynecologist. Most importantly, I want to say I love you all, and I love myself too. Have a wonderful day. Have a wonderful rest of your week. Bye-bye.